Starting now. Hello and welcome. My name is Ayush Gharat, and I'm the founder of Ashwas, a social initiative to aid frontline health workers, and a member of Inflame Medical Magazine, a student led medical magazine. On behalf of Inflame Magazine today, I'm going to be interviewing Dr. Carol Silva, an intensivist and assistant professor at St. John's Medical College and Hospital, Bangalore, to talk about her experiences and learnings during the COVID 19 pandemic. Ma'am, thank you for sharing your time to be a part of this interview.
Thanks, Ayush. I'm very happy to be a part of this, and it's my pleasure entirely to be interviewed and be getting interviewed by you.
Great. So let's get started then. So firstly, ma'am, could you just briefly describe your experience during this past year as you and your team have dealt with the effects of the COVID-19 pandemic?
Sure. So actually, January and February was pretty much a normal time. Actually, we did read about it in the papers and in the social media. What's happening in Wuhan,
Mhm.
and we had a hunch that things are going to hit us soon, but we were really not prepared for it, to be very frank. I still vividly remember when on March 24th, we were suddenly called on to, isolate a part of our ICU and say, like we've got to be geared up, get prepared. We're going to start admitting COVID patients soon. A lot of protocols were made like in a very short span of time, and the whole management, our ICU, all of us got together. And, just in a very brief time, we were given a very short time to plan the whole thing ahead. And I think March, April way went okay. I mean, like we weren't hit that badly. I think we were neck deep in the pandemic. I think beginning June, second week onwards. I think the whole of Karnataka, I think, as
Mhm.
such, as in we were like one of the later states to get hit. And once we did get hit, we were always in the top five, I think, amongst India of the states to get hit quite badly by this pandemic. And yeah, then all hell broke loose, to be frank. So whatever preparation we had done, mentally, physically, and all protocols. I mean, the stress was quite overwhelming, actually. I mean, like, the numbers just sort of doubled and tripled. And yeah, it was very overwhelming, to be frank. And but with time, we did get used to the whole thing. A lot of trials started getting published. We had some sort of focus direction to how to go about treating these patients. And suddenly there was some light at the end of the tunnel. And even now, though we are living this new normal, yeah, it still feels like one vivid nightmare, and I still remember each month passing by. It was quite scary. It was quite emotionally distressing, actually.
Mhm.
But it was great. Our whole team got together, and in such a short span of time, like I like the way how the entire hospital got together. I mean, like there were so many people I got to know because ours is quite a huge hospital, 1,200 bedded hospital with more than 1,000 doctors and paramedics and nursing staff. So it's like we all got together, one family, and we all helped fight this pandemic.
That's
And I'm
great to
feeling
hear.
grateful that, I was one of the frontline workers. I feel great to have contributed, and, my service, and people also got to know about intensive care as a profession. Till now,
Mhm.
we were always in the shadows. Nobody knew what an intensivist is. If I go around telling people, like, I'm an intensivist, they just look at me with this face. Then I'm like, no, 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 I'm an anesthetist. But yeah, I have specialized in ICU. And then they're like, okay, okay, okay. But now I think this pandemic sort of has brought intensivists to the forefront. They know what we do. They sort of realize our importance, and I'm happy about that.
It's great to hear that sense of unity that was developed amongst you during this
Yeah.
unprecedented time.
I didn't even know so many people existed, and like we all got to meet each other. Like otherwise, it was just like I'll be like, okay, I know he or she exists, and we just smile at each other in the corridor. But here we like actually got to know everyone, and everyone sort of got our heads together and worked together. It was great.
That's amazing to hear. Um, one on the same topic, you described some of the problems in terms of the long, the crazy work schedule that you would have had to have. What were some of the other bigger problems that you've faced during the pandemic for someone who probably isn't involved in medicine? What were some of the biggest problems that you encountered?
So not like we're not involved in medicine. So, as such, as an intensivist per se, so we do look after critically ill patients, patients in ICUs, and these patients are quite sick. So, as such, our job is quite stressful on a daily basis. But I think this was another level of stress altogether because the sheer numbers of patients, the quantity. I mean, like as an intensivist, our job is to deliver quality care, but the sheer numbers sort of just overwhelmed us. And the biggest challenge was, you have to rapidly expand the entire hospital, for which I'm very grateful because our hospital, in a very short span of time, managed to open its new, like a full-fledged COVID care center block where everything, the ICUs, the wards, the people clinic, everything was housed in one unit. So one of the challenges was the rapid expansion of the medical services, and the numbers just sort of like tumulted to this huge. We were like at a given point of time, we were having at least 600, 800 COVID patients in the entire hospital, out of which at least there would be at least 40 or 50 of these patients in the ICUs. So the numbers, the sheer numbers, and all these patients were sick, and a lot of resources had to be mobilized. We don't have a case where everyone in the ICU is always so sick. You have a mix of patients usually, where some are relatively stable, some are quite critical, but this was like everybody is sick, and we had to pool in all resources, all our knowledge together. So that was one thing. This is the sheer numbers. That was one
Mhm.
challenge. The second challenge we faced was it was quite sad because the whole pandemic and COVID per se is a disease of isolation, right? So once you get it, it's just like you've got to say goodbye to everyone, just live and suffer in isolation till the disease leaves you or the disease uh, makes you really morbid. So it was quite sad that the patients had to be separated from their families, and never before have we communicated with families over, like phones or video calls to, like communicate about the patients' suffering, agony, their ill health, and how they're going through basically. So that was quite a sad thing, and it's not something that we usually do. We usually talk to families in a close space, give them time to grieve if it's a bad news that we're breaking to them. But here, everything was on a screen. You're telling
Mhm.
a relative of a patient that he's not doing well, he may not make it, and it was quite difficult. We're not used to doing it over a screen. Plus, just it was quite depressing actually. Like to see a lot of patients, young as well as old, mostly old actually because of the pandemic. Yeah, separated from their families. Some of them had to die alone, and it was quite emotionally disturbing actually. And it was not just physical stress. There was a lot of emotional stress actually, and somehow we become more mature, more stronger actually after this pandemic.
Wow, yeah, I'm sure it must have had um, you know, a big impact on your mental state. Um,
Yeah,
and
absolutely.
so,
Yeah.
could you talk about that? How did it affect you? How, were you overwhelmed? And how did you cope with that kind of mental
Right.
anxiety?
So it wasn't easy at first. It was a lot of stress, and I mean, like I said, we were just not used to seeing such large numbers of patients being sick all at the same time and all over the hospital. So it was very overwhelming at first, but fortunately, as like months went by, we started getting more and more trials getting published. The trial of dexamethasone and things like that. So we had some focus and we had some direction later on in the pandemic, June onwards, that okay, these patients can be salvaged. It's not like all of them are going to end up dying. We can support them, we can take care of them, and yeah, as more evidence came, as newer medicines came, drugs came, it started, and even the vaccine now, of course, that has come out right now. So as more and more research came out, at least things started becoming more clearer how to manage these patients. So the stress levels and also the numbers started to dwindle over the months. So the stress levels gradually sort of initially reached a peak and then slowly did come down. What helped me a lot is my family. I totally owe it to them because I think many of my colleagues did not go home during the pandemic. Like when they were posted to look after COVID patients, most of the times they were staying in the hospitals, and many people could not go back home. Like their families were far away in another state, in another country. But fortunately, I think my strong pillar throughout this whole thing and what kept me sane was my family. I came back to my family in spite of repeated warnings from people like, don't go home, you'll get COVID. But I had a small daughter and I couldn't leave her because she was quite small at that time with no one to look after her. So I
Hmm.
had to come back home. The stress of every day, like, I could be giving my family COVID. Yeah, that was very difficult to get through. But by God's grace, and I think, yeah, just a lot of stress. And a few months later, I think we're all here in this new normal. And I think far as it's not really over. I mean, like it's not. I do believe there's a second wave probably coming up. But I think this time around, we are more mentally better prepared. We know what to expect. We have a lot more research. The vaccine also, like the vaccine, the second phase is started in India. So all these are promising things, and yeah, I do hope that the second wave is not going to hit us as bad as the other European countries or the rest of the world.
Yeah, hopefully, fingers crossed, it doesn't
Yeah,
repeat itself as bad as it did the first time. You mentioned earlier about how St. John's Hospital, the management came together to help you guys in terms of creating a whole new block for the COVID patients and so on. How else did the
yeah.
management pitch in?
Okay, so the management was very proactive and very supportive from get-go. Like they every day we used to have this protocol that was ever changing. So they uh, set aside a team just to follow up. Like in Bangalore only, there used to be initially the hotspots. So they would identify the hotspots. There'd be strict vigilance of patients who came from this hotspots. Very rapid testing, and within 2 months of the pandemic, I think by June almost, we were one of the few centers that even started testing COVID-19 for the RT-PCR test had begun. And it was like full on, like the management supported us throughout. And like I said, in a very short span, by July, the new block was even, by August rather, the new block, COVID care block was entirely inaugurated. Rapid expansion of wards and channeling in staff from all over, like nurses, doctors. It was like a proper task force was set up to ensure that everything was smooth. And not just that, the best part of it is even the Department of Psychiatry was called because they didn't even realize that the doctors might be stressed or get burnt out. So even options of counseling, or if you felt any stress, they did give you option to like channel out your stress to a psychiatrist if you needed it, or a counselor if you needed it. So the management was totally supportive all throughout, and they foresaw a lot and pre-planned a lot, and that really helped us deal with the pandemic actually.
That's fantastic to hear. It's great to see that. Um, Finally, now that things are becoming much lighter, but we're also expecting a second wave maybe. What can the general public do to ease the burden that is present on you as a healthcare worker? How can they contribute in their own way?
Okay, so my only message to the general public is COVID is far from over. So just because maybe you may be seeing decreasing numbers in India, that's not true. I'm sure you'll be seeing what's happening in Maharashtra and Delhi, um, Maharashtra and Kerala, sorry. So I think COVID is not yet over, and even though we are in this new normal, I don't think we should stop practicing wearing our masks, following social distancing. I see none of it being followed, including in big cities like in Bangalore. So even though the second wave hasn't really hit us yet, but yes, slowly you can see the numbers gradually increasing. Maharashtra is sort of severely hit at the moment. And even in Bangalore, I think there has been a doubling of numbers in the last 1 or 2 weeks.
Yeah.
So yeah, we shouldn't let our guards down. And I think still avoiding large crowds, wearing a mask compulsorily and in the right way. Everyone has a mask, but it's never covering the nose or the mouth. So I don't think that really serves the purpose. So, and still, just the fact that you just need to be aware that COVID is still there. Everyone seems to think that it's forgotten and gone back to living. I agree. The economy has to set start, and people have to work and recover from all the losses. That's perfectly all right. But stay safe, and don't forget that your health is very important, and even how you behave in a social area can affect many other people. Like if you have any symptoms of a cold or um, any upper respiratory tract symptoms or a fever, stay in, don't go out, spread it. And also, I'm worried about the myths that are going around about the vaccine. The vaccine is perfectly safe. Most of us have all taken it. There are very few known contraindications. So, please read about the vaccine from a trustworthy site, not from hearsay that you see on social media and all sorts of these rare complications that are being linked to the vaccine. Trust me, we've all taken it. A large number of us have taken it, and I'd encourage everyone to go and take the Indian vaccines. They're safe, they're well tested, and yeah, that would go a long way in sort of like helping us. And even if we do have a second wave, hopefully at least we will not have a lot of critically ill patients or
Mhm.
patients reaching the ICUs. Maybe it will definitely reduce the infectivity, and people will be probably more less sicker than compared to the first wave.
Yeah, let's definitely hope that's the case, and
Yeah.
hopefully things do begin improving. Finally, now that we've been through 1 year of COVID-19, what are some of the biggest lessons that you've learned and that the medical community has learned that we can take into the future, be it general hygiene or be it touch wood it doesn't happen, but if another pandemic comes across, what are some of the biggest lessons that we can take ahead into that?
So yeah, that's a good point you mentioned about general hygiene. I just noticed the number of people who've started using hand sanitizers, not just the general public, but our doctors, I feel, or nurses, or just the healthcare staff. I mean, we're so much more aware right now. Like even before this, there were CDC and WHO guidelines in place that you have to hand wash and you have to keep yourself clean before you go to a patient. But now I think it's more easier said than done.
Hmm.
So the biggest lessons learned, I think I don't know for me. I mean, I'm just speaking on my behalf, but I think all of us doctors and colleagues together, we've become so much more mentally stronger. And this pandemic has taught everyone. I mean, it may not be a healthcare person, it be even just a lay person, everyone a little bit about life and our loved ones and the importance of them, I guess. And yeah, I'm very astonished at the medical fraternity as to like how rapidly research came about, and in a span of at least 6 months, we had a clear idea of drugs that may or may not work. A lot has changed. Like prior to this, steroids were not really used for viral pneumonia, but right now steroids are like the mainstay of treatment for COVID-19. So yeah, this pandemic has taught us a lot, both in the medical and non-medical sense. I think we've emerged much stronger, more clearer, and there's a lot of lessons learned. Like if we do have to face another pandemic, like you said, I think this pandemic has sort of set goals for us, and we have learned from our mistakes. And hopefully, if another pandemic sets us, God forbid, though, I think we should be better prepared as a country, as a hospital. Uh, yeah, I think we should be better prepared.
Fantastic. And with that, we'll wrap it up for today. Ma'am, thank you so much for your time and your wonderful insights. It was a pleasure
Thanks, Ayush.
speaking to you.
And
Oh, yeah, go ahead.
yeah, it's an absolute pleasure. And I do want to also thank you. And I believe you have supported us a lot by donating or arranging around 2,400 PPs. And we are absolutely grateful to you for that. Someone at your age bringing up this campaign and helping us. I do also thank you for the comedy show that you hosted for us doctors by Amit Tandon. Amit Tandon is really one of my favorite comedians, so it's really great. Like we're very grateful to people like you. You all were one of the reasons we could smile and like have peace during the pandemic, because if PPEs were one of the things that I remember haggling with everyone. Like we want the best PPE, we need to stay safe, and people like you and all the donors, in fact, who helped us out, and other, not just our hospital, other hospitals elsewhere. We're very
Mhm.
thankful to people like you. Yeah, so thanks a lot. This is from the entire department and from St. John's.
No, it's completely my pleasure. I think it's just my way of showing gratitude to all the amazing work that each and every one of you has been doing, and I think it's just a small token of appreciation, really. So nothing more than that. And really,
No
it was a
problem.
pleasure speaking to you as well. And I wish you all the very best. Uh, in your
Thank you so much. Thank
duty.
you so much,
And
Ayush, and wish you too all the best for your pre-board exams.
thank you. Hopefully, it'll work out.
Yeah, don't worry,
And,
nothing will happen.
and to all our viewers, I hope you enjoyed this interview. Stay tuned for more such inspiring interviews, and we'll see you all next time.